Hi. In today's conversation, I'd like to talk about a variant of the abstract, which is a structured abstract. Uh, More often than not, an abstract is used for a scientific presentation or a scientific manuscript, whereas a structured abstract is used specifically for describing the results of a clinical study or a clinical trial. Um, Again, sometimes it's not defined within a medical writing assessment whether an abstract or a structured abstract is expected. However, when you open up the assignment or open up the medical writing assessment and see that the content that's presented to you is not really a scientific paper, but more so of a clinical paper or perhaps the outcome of a clinical trial, then the safer approach is to go with the structured abstract approach. Now, it's called a structured abstract because there are certain headings which need to be mentioned within the abstract, and the appropriate content which fits that heading needs to be described. So the first item is the objective and the endpoints. The endpoints should have a greater priority than the objectives because the endpoint is what determines the outcome of the clinical trial. So scan through the content and look for objectives, look for endpoints. If the primary and secondary objectives are very long statements, then it would be better to describe the endpoints as opposed to the objectives because that takes greater precedence. It's higher on the priority list as far as putting it in the structured abstract is concerned. The second heading is design. Is the trial open label? Is it randomized? Is it double blind? Is it single blind? These are terms which you can see. Is it a multi-center trial? Um, these are terms which you can see in the manuscript and extract and talk about the design of the trial. The third is about talking about participants. Are the participants coming in after having a diagnosis of a certain condition? Are these people who have been diagnosed with type 2 diabetes, diagnosed with stage 1 cancer, diagnosed with Alzheimer's disease? How many were male and female? What is the demographic? These are some of the high level basic things which can be discussed under participants. The fourth is intervention, which is what is the drug, what is the device, what is the method of intervention? Is it just a single intervention? Is it a combination therapy? Those things need to be described in just a simple statement, a simple sentence. The next is outcome measures. What is being used in order to look at the outcome? So the patient comes in, they have this intervention, and then what is being measured? And that's the outcome measure. That's important to describe. Item number 6 is results. That's fairly straightforward, fairly simple. And item number 7 is conclusion. What is the conclusive statement? Was the primary endpoint met? Was the primary and the secondary endpoint met? Is there anything to talk about in terms of safety? And even when discussing the results and conclusions, the order is describe the primary endpoint first, secondary endpoint next. If there's an exploratory endpoint, that can be described. And following which, if there are any safety concerns which need to be described, then those can be described. And finally, item number 8, this is something which many people miss out, is the trial registration number. This is an alphanumeric which describes the search term or the search designation which is used to find this specific clinical trial in a national database. Many applicants would prepare the structured abstract but might have forgotten to include the trial registration number. This is not something which is going to determine the quality of your structured abstract. The structured abstract can stand alone as a good piece of writing even without the trial registration number. However, when you do include it, it gives a sense of thoroughness. It gives a sense that you have done the research to find out every little thing, every little heading that has to go in a structured abstract, and you've gone the extra mile in order to include that information. If you just put the title of a clinical paper in Google, followed by trial registration number, you can easily find that. You'll find it on the first page of hits. It's not very difficult to locate. So think about these things. I will include the headings that you need for the structured abstract in the description. But I always keep this list with me whenever I'm preparing a structured abstract. So to conclude, let's just quickly go through that list again. The objectives and endpoints. Number 2, design. 3 is participants. 4 is intervention. 5 is outcome measures. 6 is results. 7 is conclusions. And 8 is the trial registration number. All the best.